And I'm going to keep going on her left side. We're switching sides of the room, but same orientation as we were before. So what we did was work with our elbow/forearm and work around the trochanter, right? All the way around like that. And now what we're going to do is we're going to palm press the lateral thigh. And so what we're really doing is we're kind of treating the IT band. And so some of you might want to come closer. I'm trying to walk my hands along the anterior and posterior edges of IT band. I personally am not a fan of working right on IT band. I think it's just tender and there's not much benefit in my mind to that. So and you can see if I alternate, it's almost like I'm rolling that IT band back and forth. A little tender. Probably the most common issue that I see with IT band, one of the symptoms that people have is that they complain about where it attaches at the knee. The other place is what Jessica's experiencing is this tenderness along this posterior line where it can get adhesed with that outer hamstring. And so that first step is what I'm doing here, but I think I also can come in, this is a palm over palm, and what I'm trying to do is hook that posterior line. I'm just showing you with one hand at a time here, but what I would do is both hands like this. See if I can make sure it's released from the other tissues that are adjacent. Is that okay? Mm-hmm. Good. And then keep coming down the leg right over the fibulari. So that actually completes that whole unilateral sequence that we've been up to. And now we're gonna do a couple of bilateral things to finish up this position. So next, I'm gonna get up on the table. This is the first time we're officially on the table. Some of you got on the table for that heel stretch that we did like that. So I wanna be in a staggered stance like this. And just like when we did the single leg quad stretch, I want to do just the legs first. Let the feet be neutral. And this is both, of course, a treatment, but it's a good assessment because you're going to feel differences from side to side sometimes. Now include the foot. And include the toes. And for the last one, give yourself a nice lunge. Okay, so then I'm going to keep going with the left leg first. I'm going to take that leg so the knee goes outward, and I'm going to capture that foot behind the right knee. Those are that if you're behind me, you definitely want to see this. I want it so that she's in tree pose again, and just her toes are captured here. I'm not trying to press here. This is just to hold the foot in place. The goal of this technique is to compress. The photo is showing like I'm compressing down on the leg, which I will be. I'm starting at the hip, and then I'm going to work my way down. You need to maybe or get rid of the bolster or just be willing to work around it, move it around as necessary. And then that takes us right into the prone tree hip flexor stretch. So I want to grab under this right knee here, and I'm gonna manage how deep that quad part of the stretch is with this foot position, and with a nice straight arm, Don't help me though. Try and relax. Good. Very nice. So look at my posture. I'm nice and upright. My arm is hanging. I'm not doing this. Right? I'm not lifting it with my scapula. It's only as far as my lunge will take me, and I can deepen it by pressing her foot down. I don't need to crank her way over here. So, well, she doesn't need that, right? So if I need to deepen it, I can lunge more and I can press her foot down more.
I have a question. If someone has bad knees, is there an alternative?
There are no bad knees. There are knees that need more love.
Okay.
I mean, that was, anyway. So you might not want to deepen the flexion, right? You can keep the foot neutral and do it like that. And then it's more of a hip flexor stretch at that point.
Okay.
So you'll have to fine tune that, yeah. Okay, then we'll repeat that on the other side, right? So we'll take that knee out, tuck that one in. This is where we get used to moving around on the table. Like that. Again, using your lunge, nice and tall. Just get very flexible quads. I'm gonna just keep going to the end and then I'll come back and we'll read all of it again. Okay, so here, this is where I'm gonna actually squat on top of Jessica. So I want my feet between her knees. And I want to rest my knees just inferior to her ischial tuberosities, like that. And I think it's worth doing a little bit of a warm-up. So this is where you want to practice bringing your weight. So I can actually do this. See, I'm not going to break her, right? Okay.
She's like, okay.
I guess.
Yeah. Palm pressing up the spine. And see, I'm pouring weight onto and off. Come down onto the arms. It's just a nice little palm walk sequence that takes you to the hands. And then here, I'm going to ask her to hold my forearms. So we're interlocking forearms, and with a big inhale, look up to the sky. Look up to the sky. Ooh, nice.
Oh my God, that looks so good.
Hold on. Use your hands to hold on. Good. Very nice. And come down. Let them rest. Hold on again. Inhale, look up. And on the second one, super person, steering around buildings. Left turn, steer around those buildings. Back to center, and with center, look how much more she went. Very nice.
How's that feel? No.
Ooh, sorry. Now come back to child's pose. So push yourself back so your pelvis is sitting on your heels. Yeah. Put your hands under you here like this and push yourself back. So your pelvis is sitting back like that. And then just lay forward like that. Very nice. Actually, I'm going to take the bolster out. Let's do it. Good. So then, push them down. Give her a nice counter stretch to that back bending. And if you want to get fancy, you could back bend like we did just a few minutes ago. You could, they're going to wonder what you're doing. But how's that feel? All right, go ahead and lay back and we'll break that down. That was fun.
Wow, that looks
I'm not actually going to skip the bolster. The bolster, it's worth it for the legs, but then it's kind of in the way. So you have to sort of, I would say, learn to get used to it, but also just be willing to get it out of the way. That one's particularly big. I use the 9-inch half rounds, which aren't quite as sticky-outy. It's a little easier to navigate around. Okay, back to the beginning, right? So from here, we're gonna palm press along the anterior and posterior lines of the IT band. And we're gonna double palm compress just the posterior line. So I already see something I need to adjust. So in reality, somewhere in your notes, what you need to put here is that when you get to palm press lateral leg, you go all the way back to unilateral palm press the back on the other side and do that whole sequence to here before we do the double hip flexor stretch.
Because that's the end.
Because that's the end of the two unilateral parts, and now we're doing the bilateral part at the very end for the finale.
Yeah.
Follow?
So both sides and then the...
Yeah, so let's say I just did that, and I had just worked this whole side, which I had. Now I have to come back to here and do this, and the hip pull, fast forward, arms, all this good stuff, right? All this, 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 all that, all that, all that, to there, right? Now I get on the table to here. Does that make sense?
Yeah, because it's the finishing moves.
Well, clearly it makes sense to you. I'm checking in with the, the ones that are slower. Okay. So that way we finish with the bilateral part. And yeah, let's just stick with that. So that's what we're gonna do. So now we've got 3 stretches, right? Legs, feet, and toes. And the reason that comes up is because we did this, right? And then we did the stretch. And we have to do it on the other side, right? And so we needed to have completed that whole other side to get to this point. Right? Like that. And then cobra pose and child pose. Okay? For practice sake, just go through it as if you just finished the second side. Okay? Thank you, Jessica.